My name is Georgianna Stoukides, and I will be presenting my research conducted under the guidance of Dr. Jacob Vandenberg at the Brown University School of Public Health. Our study is called the Minority AIDS Prevention Project, or Project MAP for short, and today the title of my presentation is The Development and Evaluation of an Educational Website Culturally Tailored for Black, African American, and Hispanic Latino Men Who Have Sex with Men in the United States. Although there have been advancements in science to minimize the rate of new HIV infections and improve the life of those living with HIV, the HIV epidemic continues to be a major public health concern in the U.S. More specifically, Black African American and Hispanic Latino men who have sex with men, or MSM for short, are disproportionately affected by HIV in the U.S. Here, I present two graphics from the U.S. Centers for Disease Control and Prevention with the most recent data available from 2018. On the left, the pie chart shows that Black African Americans and Hispanic Latinos are affected by HIV at a higher rate than their white counterparts. In particular, Black African Americans and Hispanic Latinos accounted for a combined 69% of all new HIV diagnoses in 2018. The graphic on the right shows that Black African American and Hispanic Latino MSM had the highest incidence of HIV infection compared to white MSM and to people who engage in heterosexual contact. There are a few reasons why Black and Latino MSM are disproportionately affected by HIV. Historically in the U.S., the MSM community has been heavily stigmatized as a result of the HIV/AIDS epidemic. As Black and Latino MSM are racially and sexually marginalized groups, they face greater discrimination, homophobia, and stigma than their white peers. Systematic discrimination in healthcare and education makes it harder for these groups to access high-quality healthcare and HIV prevention and treatment education. And more often than not, healthcare professionals seem to lack the cultural competency and sensitivity to discuss HIV prevention and treatment methods with Black and Latino MSM. With barriers to HIV education and care, Black and Latino MSM ultimately have lower rates of uptake of HIV prevention and treatment methods, and they have higher rates of new HIV infections. Before I describe our research study, I'd like to explain some of the terminology that I'll be using during this presentation. First, undetectable equals untransmittable, more commonly known as U equals U. When an individual living with HIV takes their medication every day, the amount of HIV in their body, or viral load, reduces to a very low level. Gradually, their viral load will become so low that a test cannot detect it. This individual is now undetectable. Being undetectable helps people with HIV stay healthy, but because their viral load is so low, being undetectable also means they cannot transmit the virus to people who do not have it. Second, treatment as prevention, or TASP, is a more general term to explain the act of taking your HIV medication to prevent the transmission of HIV to other people. Third, pre-exposure prophylaxis, or abbreviated as PrEP, is a daily oral medication that people without HIV can take to minimize their risk of HIV infection. To address the low rates of PrEP and U equals U uptake among Black and Latino MSM, we decided to take a novel approach to this issue. We created an interactive and educational website with information about HIV prevention and treatment called For Him, which stands for HIV Information for Minority Men. Our website is specifically tailored to meet the needs of Black and Latino MSM. After creating our website, we conducted 20 individual cognitive interviews with MSM in New England who identified as Black, Latino, or both. Participants were asked about their experiences navigating our website and their thoughts about HIV prevention and treatment methods, including PrEP, TASP, and U equals U. We interviewed 10 participants who were living with HIV and 10 participants who did not have HIV. The majority of participants identified as gay or homosexual. Most participants were non-Hispanic Black, while the rest identified as Hispanic or Latino. Of note, most participants were single at the time of the interview, and almost all participants were covered by health insurance. 4 major themes were identified from the cognitive interviews. The first theme includes participants' awareness and knowledge of HIV prevention and treatment. The second theme includes their intentions and behaviors towards PrEP, TASP, and/or U equals U. The third theme includes participants' experiences with primary care providers regarding the uptake of HIV prevention and treatment methods. The fourth theme includes participants' opinions about the structure and content of the newly developed website. In terms of awareness and knowledge of PrEP, all participants without HIV had heard about PrEP before, and the majority were able to give a clear and correct definition of it, while some had heard about PrEP but could not define it correctly. For example, one 31-year-old Black and American Indian participant said, "It's just to help prevent HIV or STDs, something like that," which is not entirely correct since PrEP does not protect against other sexually transmitted infections. Among participants living with HIV, awareness and knowledge of TASP and U=U was not ubiquitous. About half had not heard of either TASP or U=U prior to participating in the study. More than half knew about U=U and said they preferred the term U=U to TASP. For most of the participants with HIV, the term U=U seemed to make more sense to them than the term TASP, as it relates to understanding their undetectable serostatus. After viewing the website, participants noted that they learned new information about HIV prevention and treatment. Participants without HIV said they learned more about PrEP. Participants living with HIV noted that they learned more about TASP and U=U, as well as more facts about HIV medications and HIV infection rates. Almost all HIV-negative participants said they had not used PrEP before, and some identified reasons for not using it. Reasons for non-use included not having a chance to speak with their provider about it, concerns over the side effects of PrEP, not wanting to add medications to their daily routine, and not currently being sexually active. Almost all participants said they would consider taking PrEP in the future, but some noted concerns over potentially being stigmatized by others as promiscuous if they were taking PrEP. Among participants living with HIV, some said they had practiced TASP before to protect people without HIV, while others indicated that they were taking their HIV medication to protect their personal health only. Whether or not they had used TASP before, the majority said they would consider TASP in the future to protect their community. When talking about his practice of TASP, one 40-year-old Mexican participant said, "HIV stops with me." Among participants without HIV, one described that his friends had negative experiences getting PrEP prescriptions from their providers. He also said that he had not seen a primary care provider for at least 2 years. Some participants then noted that they would like it if the newly developed website had more information about how to talk to their doctors about PrEP, highlighting the need for effective communication between MSM of color and their providers regarding PrEP uptake. One participant without HIV also said that he would feel more comfortable talking about PrEP if his provider was also gay, demonstrating how important it is for providers to be understanding and sensitive to patients' needs and perspectives. Among participants living with HIV, many talked about how important the patient-provider relationship is in keeping someone in HIV care. One participant specifically pointed out that typically members of the LGBTQ community do not visit their doctor for preventative health care. A different participant said his provider did not talk to him about how HIV treatment can typically impact bone density levels, so he will go back to his doctor to discuss this. In summary, by hearing the stories of HIV-negative and HIV-positive participants with their doctors, we learned that it is incredibly important for primary care doctors to be sensitive to each patient's needs, creating an environment where the patient can learn more about HIV prevention and treatment methods without feeling judged or criticized. Here is the website forhim.com and some of the key features that participants mentioned in their interviews. This is the main page. We have a tab for people to learn more about U=U, and one for people to learn more about PrEP. Here, we have a link to a quiz that helps website users find what they're looking for on the website. As we scroll down, we have several tabs that outline the content of the website. And we also have a search bar here. Further down on the main page, we have 2 quizzes for people to assess their risk of contracting HIV. We have translated the website and all of its subpages into Spanish as well. For people seeking access to PrEP, we have created a page that provides guidance. Here, we have a few tips about how people can talk with their provider about PrEP. We also have a link to a page that has a list of providers in Rhode Island that prescribe PrEP. These providers have been recommended by men who have sex with men. Here, we have more information about insurance coverage for PrEP. The PrEP Locator is a database that helps people find a doctor near them that prescribes PrEP. Finally, we have the PrEP Navigator chat box, where people can ask questions regarding PrEP to trained members of our team. For people living with HIV, we have a tab about U=U. We have also added a forums page where people can discuss U=U or other HIV-related topics. Finally, we have a community stories page where we have stories that Black and Latino MSM have shared with us about HIV prevention and treatment after replacing each of their names with a pseudonym. All participants provided positive reviews of the website, saying that it was easy to navigate. They said that they would come back to it and also recommend it to a friend. One participant in particular said that the website is the kind of place that has the information that you would need, which is what we wanted to accomplish, having enough information about HIV prevention and treatment without it being overwhelming for website users. Participants discussed the specific features and content they liked most from our website. Highlights of these include the amount of information provided, the fact that the website is also translated into Spanish, the page with community stories, and the PrEP Navigator and PrEP Locator. One 31-year-old Black participant said that instead of trying to pick a page off Google, he could use our website as his home base. When participants without HIV were commenting on the website's content, they focused more on the information surrounding access to PrEP. In particular, they offered positive comments for the PrEP Locator, the PrEP Navigator, and the Find a Doctor section of the website. Participants with HIV focused more on how the website is a great source of reliable information and guidance for people who just found out they have HIV, or for people who may feel alone when navigating their life with HIV. When talking about his experience with the website, a participant who's 50 years old and Black said, "I wish I knew this before. I wouldn't be HIV positive." A 23-year-old Puerto Rican participant living with HIV said he liked the community stories page because it made him feel part of a community. We have updated the website layout and content according to suggestions that participants made. Some of the suggestions that they mentioned are having quizzes on the website, having a forum, and highlighting that PrEP protects only against HIV infection. Participants were also asked to talk about what they think of the website being tailored for Black and Latino MSM. Most participants liked that the website is geared specifically for their communities. One 37-year-old participant without HIV said, "We have plenty of other websites that focus on everybody, and that's part of the issue." He said, "We need websites and resources that focus on us." A participant living with HIV agreed with this perspective, saying, "Our website is a step in the right direction." However, some participants did not agree with that perspective and would rather want the website to address not only Black and Latino MSM, but others as well. One 36-year-old Puerto Rican and Mexican participant noted that HIV is not a race and anybody can catch it, so why limit the website audience to just Black and Latino MSM? A different participant, who was 59 years old and Black, said, "I think it should be inclusive of all." Although PrEP awareness and knowledge was high among participants without HIV, almost all of them had not used PrEP before. The primary reason for this was that they had not discussed it with their doctor. Although they had not used PrEP before, almost all participants were considering PrEP for the future. Participants with HIV preferred using the term U=U more than the term TASP, and almost all participants were considering practicing U=U in the future to protect their community. From comments participants made and from their level of basic understanding of HIV prevention and treatment, participants demonstrated that their relationships with their doctors had not been as helpful for them to get the right support and information about HIV prevention and treatment. All participants found the website to be very informative without it being overwhelming. In addition, they offered feedback that was helpful to create the final version of the website. When browsing the website, participants without HIV mostly discussed PrEP and how to get access to it without having to interact with their own doctors. Participants with HIV commented more on how the website makes them feel that they're not alone and that they're part of a community now. Overall, participants liked the idea of a website being specific for Black and Latino MSM and felt they learned a lot of helpful new information from it. As for future directions, it is becoming increasingly important that healthcare providers discuss PrEP and U=U openly with their patients without making them feel judged, especially when discussing with Black and Latino MSM. Participants reported that the website can offer a lot of support when it comes to accessing PrEP or learning more about how to live with HIV without feeling alone. In such a digital age, it can be very helpful to have educational websites that people can visit whenever they want. As for the progression of our study, after we created our website, we also made social media messages to promote it. In a randomized control trial, we have been sending these messages on Facebook, Instagram, and Twitter to Black and Latino MSM to see if we can get more people on the website and ultimately more people on PrEP and U=U. Lastly, in order to combat the HIV epidemic in the U.S., it is important to address the needs of the communities most affected and stigmatized by it. Creating culturally tailored responses through social media that offer support and guidance for Black, African American, Hispanic, Latino MSM is imperative. We also need to prioritize the perspectives of these men and create safe spaces online so that they can easily find accurate and up-to-date information about HIV prevention and treatment. Our website is part of this mission, and we hope that more public health interventions focusing on HIV will prioritize the needs and voices of Black, African American, and Hispanic Latino MSM. On behalf of the Project MAP research team, we would like to recognize all of the men who participated in this study. Funding was provided by a grant to Dr. Vandenberg from the U.S. Centers for Disease Control and Prevention's Minority AIDS Research Initiative. And last but not least, we would like to acknowledge our community partners who were invaluable to us in assisting with participant recruitment and retention, as well as providing us with helpful feedback on our study-related materials. Thank you for watching this presentation today. If you'd like further information, please feel free to email us at Georgianna_Stoukides@alumni.brown.edu and Jacob_Vandenberg@brown.edu.